oral health care spotlight. Tonight in our oral health spotlight is flossing and periodontal disease. Ding ding. Did you know that 80% of Americans have some form of gum disease? But flossing can help to prevent this. But most people won't floss. It's like 80% of people have some type of gum disease, but 80% of people also don't floss. Is this a myth or no? So bleeding gums means you need to floss more, not less. True? Floss? How do you feel? So bleeding gums means you need to floss more, not less. This is true. You need to probably floss more. Unless you're on some type of blood thinner where if you're flossing too hard and you're bleeding or something, you still need to floss. But so a lot of patients feel like, dang, when I flossed my gums bleeding, so I stopped. It's like, actually that means you need to continue flossing. You need to floss every day, not less, because 9 times out of 10 this is some type of bacteria that is embedded under your gum line. They are producing toxins from the acidic environment that you are creating, and then you're not brushing things away, and they are destroying your bone, they're destroying your teeth. And if you don't floss, this allows them to build little communities on your teeth and start little families, and then this is trouble. So this is why you want to floss, so that you don't contribute to your own demise. You don't contribute to having periodontal disease. Flossing is a dental version of daily discipline. This is something that we need to do every single day. I can guarantee if this is something that you put on your 365-day consistency challenge, a lot of people would fail, because it's, even though it only takes 2 minutes, unlike me saying, okay, I'm going to go live on Twitch for an hour, some people would find that easier than flossing every day, because it's just not taught. It's not taught in school. It's not taught in a lot of homes. A lot of people just don't know. People who grew up in poverty like myself, we just never heard about flossing. Even when I learned about brushing my teeth in elementary school, they really didn't discuss flossing. Like, I have a pretty good memory. Maybe they did, but I just remember them saying brushing in circles. You know, that's the one thing that I picked up. And flossing wasn't really talked about much. It's just not really talked about much, if I can say so. So it is one of those things that is highly preventable. It's highly authoritative when it comes to helping you decrease your risk of getting periodontal disease, bone loss, and ultimately tooth loss, which can happen. Tooth mobility, your teeth start moving out, and then you need other things to replace your teeth. Edentulous patients lose 5 to 6 years of life automatically, because they can't really break down the nutrients when they're eating, and their body works a little bit harder, so it takes away life from you. Okay, it takes away the life, it takes away the motivation, the creativity, all that, because now teeth are an essential part of who you are, your confidence, your self-awareness. April is Oral Cancer Awareness Month. Certain oral bacteria linked to increased risk of head and neck cancer. So certain bacteria in your mouth, in my mouth, can be linked to an increased risk of head and neck cancer, especially if you have a lot of this type of bacteria in your mouth, because you're not flossing, brushing, taking care of infections and cavities and things like that. You allow these bacteria to just destroy everything, girl. Everything. They gonna destroy everything. Okay. So the researchers at NYU Langone Health have connected certain bacteria linked to gum disease with an elevated risk of head and neck cancer. Okay. The researchers identify higher levels of Fusobacterium nucleatum, a type of bacteria often found in periodontal disease, F. nucleatum, in cancer patients. This finding suggests that the bacteria may contribute to cancer development by driving inflammation, and altering immune system responses. This research offers new insight into how oral health might influence cancer risk, potentially paving the way for novel approaches to prevention and treatment by targeting these oral bacteria to help reduce the risk of cancer. So there are certain tests that we can do as dentists to kind of like triage what type of bacteria you have in your mouth, and this study would kind of help if you want to see if somebody has a higher risk of oral cancer, or if they have like a suspicious lesion. You can test the bacteria in the mouth, or if you're just testing the mouth and you notice this type of bacteria, you know this is going to increase their risk of head and neck cancer. So you want to kind of decrease that bacterial load, maybe put them on some type of perio trays to wear so that they can decrease the risk of getting oral cancer, because oral cancer is aggressive. That's why I do oral cancer screenings. If you come to me, 10 times out of 10, I'm going to do an oral cancer screening at your periodic exam, checking your lymph nodes, checking your submandibular glands, checking under your tongue, just checking the whole entire oral cavity for any suspicious lesions, and to make sure that we pay attention to those or do further investigations to make sure that it's not oral cancer, because it's better to spot these things earlier than later, because I have had several patients come into the office with oral cancer, and it is a very aggressive disease. Sometimes you lose your tongue, you lose your throat, you may be in a feeding tube. It's in this area, so it's really a traumatic thing. So we want to be aware of this, and this is Oral Cancer Awareness Month, guys. The next study that we're going to talk about is tea and coffee may cut cancer risk. What? I've been trying to preach to my patients to stop drinking so much coffee because it stains your teeth. Caffeine, it increases your blood pressure, and yeah, it has other things that aren't so great. But this study is saying tea and coffee may cut cancer risk. That's what it said. Don't shoot the messenger. It says a new study published in the journal Cancer suggests that drinking tea and coffee may reduce the risk of developing head and neck cancer. Okay? According to the team, people who drink more than 4 cups of caffeinated coffee a day had 17% lower odds of having head and neck cancer overall, 30% lower odds of having cancer of the oral cavity, and 20% lower odds of having throat cancer. The study even found that decaffeinated coffee had some beneficial effects. So they're saying coffee and tea might lower your risk of cancer. They have a lot of natural properties in both of these, tea and coffee, that probably inhibit the growth of that bacteria that we were talking about earlier that is linked to periodontal disease. So some type of way it may inhibit or slow the growth of those cancer causing properties. To remind you guys, before you go to bed tonight, to brush and floss your teeth. Please and thank you.